Welcome to Selling and Designing Simulation to Resistant Educators. The views and opinions contained in this presentation are those of the author and do not necessarily reflect the views of the Department of Defense or ICF International, and should not be construed as an official position, policy, or decision of either entity. No official endorsement should be made. References herein to any specific commercial products, processes, or services by trade name, trademark, or manufacturer do not necessarily constitute or imply their endorsement, recommendation, or favoring by the United States government or ICF International. The objective of this Tech Talk is to review some of the technology or medical simulation methods of delivery, as well as one approach to use in designing a group of simulation exercises to supplement and improve learning outcomes for students.
Hi, I'm Mike, Director and one of the lead instructors in the new EMS program.
And I'm Laurel, the Simulation Coordinator. Mike, the purpose of this discussion is to introduce you to the many ways simulation can enhance and augment your programs. I'd like to start by defining what simulation is and then explain some of the adjuncts available to you. I would also like to explain why adding more simulation activities to your program will result in improved learning outcomes from your students, and finally, an example of how we could accomplish this.
Well, okay. But I'm not at all sure we have time for playing around.
I understand your concern, but bear with me for just a few minutes and take a look at what simulation has to offer you and your students. Perhaps by the end of our chat I can change your mind. First, if constructed carefully and correctly, simulation can be viewed as a well-defined exercise designed to make a practice session as realistic as possible. In essence, it is the suspension of disbelief.
Okay, so it's skills practice like we do when we practice intubation on the intubation mannequin. We already do that.
Well, yes, that's one form of simulation, but there is a whole lot more to simulation than just practicing skills on a task trainer. Let me give you a few examples of types of simulation and some ideas about how you might use them to augment learning objectives. I know you're familiar with these two task trainers. As you know, they are really good adjuncts for teaching individual skills and the processes associated with them. The advantage to them is that they're relatively inexpensive and easy to maintain. They also allow for repeated practice until desired levels of competency are achieved. On Fred, students can practice insertion of an oral airway or an endotracheal tube and see the lungs inflate with ventilation. With HARM, they can insert an IV catheter and experience the flash of blood in the catheter chamber. However, task trainers are limited to specific skills and provide limited feedback. They are great adjuncts for learning the basic skills, but only allow a specific skill set to be performed on them. It's difficult, if not impossible, to add additional skills when training with them. In effect, they are skills performed in a silo.
What do you mean by other skills?
Well, by other skills I'm talking about things like complete patient assessments, critical thinking, teamwork, and patient communication.
Okay, I think I see where there are some possibilities here.
The next pictures are also task trainers. The Trauma Man and the Harvey are two examples of some of the more sophisticated task trainers available. The Trauma Man is an anatomically correct torso for students to practice several trauma-related surgical procedures. It includes 4 anatomically correct surgical zones, which can bleed when incised. Only a few of these skills would actually apply to your paramedic students, but it gives you an idea of what a more advanced task trainer can provide. The Harvey is another one of the more advanced task trainers. It is a cardiopulmonary simulator that reproduces very realistic lung and heart sounds. The heart signals not only vary with the disease state programmed, but with the area of auscultation as well. These are also great for learning and practicing skills. They are just more advanced skills. However, they only allow students to learn just the skills themselves. So, like the Fred and the Harm, they're great for learning a skill or a set of skills, but not really effective for much else. The pictures from the top left are the CAE or MEDI iStan, the Gamard Susie, Pediatric HAL, Adult HAL, the Noel Birthing Simulator and the Infant HAL, and finally the Laerdal 3G. These are a small sampling of the high-fidelity simulators currently available on the market. All of the mannequins shown are tetherless, meaning that they can be placed nearly anywhere and are run via a Wi-Fi connection to their controlling device. Usually this is a laptop or tablet computer. They do not require external compressors or connections to be fully functional. Our simulation lab currently has a family of Gamards. We have the HAL, Pediatric HAL, Noel, and Infant HAL. This is a rather busy slide, but it's intended to demonstrate some of the many capabilities of high-fidelity mannequins. Some, like the HAL pictured here, come in various skin tones. Most have eyes that can be programmed to be open and blinking or closed. They have pupils that react consensually to light along with programmable pupil size and reaction time. Heart, lung, and bowel sounds are also programmable. They show visible chest rise and fall with spontaneous respirations or mechanical ventilation. They have multiple lung sounds that can be varied for each lung field, and programmable compliance and resistance for use with a ventilator. Some have dynamic 12-lead EKG monitoring and work with virtually any cardiac monitor on the market. They can be defibrillated, cardioverted, and paced, and all procedures can be performed with the actual recommended levels of electricity. They have bilateral pulses at the carotid, brachial, radial, femoral, popliteal, and pedal pulse points, blood pressures with actual carotid cuff sounds. They have wireless streaming audio and some pre-recorded voice sounds. Procedures that can be performed include IV lines, needle decompression, tracheostomy, intubation, nasogastric tube placement, and tibial interosseous. Most of them can also be purchased with drug recognition options. Noel is a birthing simulator that allows for treatment of the mother and infant before, during, and after delivery. Some of Noel's features include normal and abnormal heart and lung sounds, feedback when CPR is being performed that includes correct placement of an endotracheal tube, as well as depth and rate of both compressions and ventilation. She has pre-programmed scenarios for both normal and abnormal childbirth, including postpartum hemorrhage, instrumented delivery, breech presentation, shoulder dystocia, and a cesarean section. Customized scenarios can easily be added as well. She can also function as an episiotomy trainer. The Infant HAL is a comprehensive newborn simulator that can be purchased with Noel or as a standalone simulator. Some of its features include normal and abnormal cardiac and respiratory sounds, color and vital signs that are responsive to hypoxic events and interventions. He can be used for APGAR scoring, oral and nasal intubation, IV training, and umbilical vein cannulation. He has palpable pulses including an umbilical pulse. He cries and can be programmed for convulsions. In addition, he has interchangeable genitalia, and the students can actually clamp and cut the umbilical cord. Serious medical games are another option to enhance student learning outcomes. Many of these games are free downloads that the students can use on their own time to supplement their learning. The 6-second EKG is a free online game that presents 27 of the most common cardiac rhythms. It has a learning mode and a play mode. In the play mode, the object is to see how many rhythms the player can correctly identify in 1 minute. The scoring at the end tells the player how many rhythms he or she correctly identified, the percentage that were correctly identified, as well as the average amount of time it took the player to correctly identify a rhythm. EMS Challenge 1. This site is a site with numerous free games, most of which are set up like a Jeopardy board with questions surrounding a specific topic. The one pictured asks questions about medical, legal, and ethical issues. Other topics include airway, shock, allergies, trauma, and triage. 0 Hour America's Medic is a first-person video game designed to train and exercise first responders to respond to mass casualty incidents. The scope of practice of the tools in the game are geared primarily towards paramedics, and in this game, players are dispatched to a chaotic scene and must select the proper equipment and appropriate action as the scene unfolds. There are actually more types of simulation. Virtual reality and the use of the standardized patient are two, but those are not currently available on our campus. Mike, I presented you with a lot of information about the types of simulation that are available to you. So, how are you feeling about simulation now?
Well, it seems there are a lot of possibilities for doing simulation, but I still don't see why you think it will enhance our students' learning outcomes. We've used lecture and slide presentations for a long time, and it seems to work okay.
I agree that lecture is totally necessary. However, there are several points I'd like you to consider. First, would you agree that the majority of our students are members of generations X and Y? And would you also agree that they are all fairly computer savvy?
Yes, that's definitely true.
The majority of our students have grown up with gaming systems such as the Nintendo, computers, and the Internet. Most of the individuals from these generations possess an inherent fascination with technology. They are accustomed to fast-paced communication through means such as instant messaging and texting. They always want to be in touch. Their smartphones, MP3 players, and computers have become a way of life. So, for educational strategies to be effective, they must capture the learner's aptitude with and desire to use technology as they gain and apply new skills and knowledge. That's the primary reason to use high fidelity and other new types of technology.
That makes pretty good sense. Are there any other advantages?
Sure. First, using high-fidelity mannequins in scenarios that are designed to meet specific learning objectives can give your students the opportunity to be involved in patient care they might not otherwise experience. I'm speaking of those patients that have low frequency and high impact on EMS personnel. Some examples are childbirth, pediatric and burn patients, and psychiatric emergencies. Another advantage is that working through a scenario with a team builds teamwork and communication skills. Simulation promotes active learning and participation as opposed to the static learning that occurs during a lecture. Other distinct advantages simulation provides are the opportunity to learn by making mistakes in a risk-free environment and the opportunity to build critical thinking skills. Additionally, using confederates, appropriate settings, and props increases the complexity and realism of the scenario.
You mentioned confederates. What do you mean by a confederate in relation to simulation?
A confederate is a person, either an actor, a faculty member, a volunteer, or even a fellow student who assists in the plot of a scenario. This person, or people, are actually scripted into the simulation to enhance realism, provide additional information for the student, or sometimes to provide additional challenges for the student. Adding confederates makes the scenario a bit more complex. Potential roles for confederates include family members, bystanders, law enforcement, and other healthcare workers. Confederates can be helpful and cooperative, or they can be disruptive, distracting, or emotional. Another way to enhance realism is to use moulage or makeup, props, and different settings. This slide shows just a few ideas of how this can be accomplished.
Wow, that's all pretty impressive. Now tell me how this would all work.
Sure. First, we choose the learning objectives for a given module. Why don't you choose a module?
How about respiratory?
Okay, we would begin by identifying key learning objectives for the respiratory module. After you have delivered the lecture portion of the module, the students would practice key skills using the task trainers in the simulation lab. For the most part, this would be simply Fred the Head for the respiratory module. Once they have gained mastery of the skills, we would then design a basic scenario. Here, they work as a team and would interact with a high-fidelity simulator to perform appropriate assessments and apply their airway and ventilation skills. Once the end of the module is reached, then we would introduce some more advanced simulations. An example of an advanced one would be presenting a patient with an obstructed airway, where a Confederate family member is present. The family member is non-English speaking and does not understand what the crew is doing to the patient. The family member will then become agitated and interfere with the team's interventions.
So I have a class of 18 students and I have a team of, say, 3 working with the mannequin. What do the other 15 students do?
Each of the other teams is given a set of areas they are to observe for. The categories are safety, communications, practical skills, empathy, decisiveness, leadership, judgment, and fact-finding. Each category has specific aspects of the patient encounter the observers are to watch for.
Tell me more about these observation categories.
Sure. For example, the team with the safety category observes the simulation participants to assure that they have taken proper BSI precautions, ascertained scene safety prior to entering the scene, and that the team immediately addresses obvious or potential hazards. The team with the communications category observes for proper radio protocols and confirmation with dispatch, watches to see that proper introduction was provided for the patient and that there was good, ongoing communication with the patient, family, and amongst the team members. Practical skills team members observe for selection of appropriate interventions and that each skill was performed correctly, and finally, that the team adjusts care as dictated by the patient's condition. The empathy observations include care and concern demonstrated by the team, that a posture at or below the patient's eye level was maintained, and that the patient's name was used frequently. The remaining 4 categories and the respective topics for the observing team members are listed here. They are decisiveness, leadership, judgment, and fact-finding. At the end of each scenario, the observing students and the instructor provide feedback to the team performing the scenario based on what they observed. One other option we have the ability to provide for the scenario debrief is an AV recording of each event.
Okay, that sounds pretty good. That means everyone should be learning, not just the team actually participating in the scenario. Now tell me, how do we go about all of this?
Well, first we start with clearly defined objectives. For the most part, they come straight from your module and lecture objectives. This is an example of the objectives for a pulmonary edema with a cardiac arrest scenario. From the objectives, we start designing the scenario. I usually will build a scenario lead-in or background first. This is the information given to the students. This is the scenario lead-in to the pulmonary edema with cardiac arrest scenario objectives from the last slide. We then move into the meat of the scenario. This is called the scenario flow. This section lists all of the pertinent patient information, usually in the form of what the patient or bystanders will provide to the student. The flow lists each section in the preferred order of assessment for the entire patient primary survey. This is the portion of the initial assessment for the pulmonary edema scenario I've been showing you. After the primary assessment, all of the expected interventions are listed so that they can be scored in the rubric. You will see a portion of that here, as well as how the case is then expected to progress. The secondary survey or assessment follows and again lists all the interventions that should be completed by the students. This slide and the next one show different possible progressions of the scenario based upon the actions of the students. As you can see, the patient's progression and outcome can depend upon the interventions actually taken by the students. This means that they must completely and appropriately assess and treat the patient, which calls for critical thinking and communication with their team members, as well as the patient and any bystanders or family presented in the scenario. This slide shows a portion of the programming for the simulator, the directions, if you will, for the operator. For simple scenarios, the programming can be done in such a way that the facilitator or the instructor can run the scenario on his or her own. The last portion of the scenario lists in detail all of the equipment, props, and moulage needed for the scenario. This helps to ensure that the scenario is properly presented and can be duplicated in the future. Does all of that make sense? How do you think this would work for you and your students?
That all sounds great. There's a lot of detail there that I hadn't expected. How soon can we get started? I would really like to pass some of those free games along to my students as well.
Great. We can start working on the modules anytime you're ready. Depending upon the module and how many objectives there are, it will probably take 2 to 3 weeks per module to build the scenarios. You'll need at least 3 basic and 3 more advanced for each module. Mike, thank you for giving me this opportunity to present to you what simulation can do for you and for your students. I'm really looking forward to working with you.
Thank you. This all sounds like some great learning opportunities for my students and my faculty as well.